My name is Kathleen Vacchelli, and I'm a psychiatric mental health nurse practitioner in Palm Coast, Florida, and I am the president and owner of Adhd Behavioral Health. Today I'd like to talk about ADHD, how to identify it, what do you do about it, and who has it. First of all, when people come into my office, usually it's parents with their young children. They're very frustrated, and they say that the children are not doing well in school. They know that the children are intelligent, but the teachers find that the grades are definitely going down. The symptoms that you look for is that they're not interested, they can't finish tasks, they can't stay on task, they get very easily distracted, they can even become hyperactive, or maybe they just get very quiet. We usually see it in 3 settings, and in order to be diagnosed with the ADHD, it has to be shown in 2 settings. So the 3 settings are in the school setting, in social settings, and also in the family setting. What happens when children are not, or even adults are not treated for ADHD? Well, number one, with children, of course, they'll fail. A lot of kids get kept behind. Also, their self-esteem is affected. They feel stupid. The other kids don't want to play with them. Or maybe because they're so hyperactive, they don't know how to play with other children. So definitely, these are the kids that are at risk for when they grow up. Many people that we see in prisons today have been undiagnosed with ADHD, or even the kids that drop out of school and use drugs. What about adults? Adults many times have not been able to keep jobs. They have many accidents. They don't do well in relationships. And now that we're talking more about what ADHD is, they're more willing to come in. What do we do about ADHD? Many times when the parents come in, they say, I don't want to put my kids on medication. What can I do? Well, I'll suggest to them maybe we can do some one-on-one therapy with them, maybe some life coaching. We have therapists here that deal with these types of issues. Or I say to the parents, or else you can homeschool them. Now we know today many parents cannot stay home and homeschool their children because they have to work. Or we can put them on medication. Now the thing with medication is that they are tightly controlled, so that we are very careful to watch these children when they are on these medications. We watch for side effects. Maybe they're not sleeping, or maybe they're losing weight. But what we do find is it makes a big difference in these kids, because what happens is it wakes up those brain cells that need to process the information. Also, with adults, it's not unusual today to put them on medication. And they're more willing to try it because they've been so frustrated throughout their life. But with adults, we find that one of the areas that they've improved in is that they have better impulse control. I should say the same thing for kids too, because we know that these kids are running around, they're very creative, they're very wanting to find out what the world is about. So what happens with the medication, it doesn't make them zombies like parents think it is, it just helps them to focus better. So if you feel that your child, or even if you're the adult that has problems, there is help out there for you. Thank you.